Hello, everyone. My name is Rosemary Truman. I'm the founder and CEO of the Center for Advancing Innovation, and I'm thrilled to welcome a trailblazer, which is part of our Dragons, Gazelles, and Unicorns podcast series. And I would like to welcome Mark Rohrbaugh, who I have been able to work with for many years. And he is a trailblazer as it relates to technology transfer and launching companies and advancing technologies. So I'm going to hand it over to you, Mark, to say a little bit about your your background and your journey, because it's quite impressive. And by the way, he just got a fantastic award. And talk about that too.
Thank you, Rosemary. It's a pleasure to be here, and thank you for the invitation. Um, I retired a year and a half ago from the National Institutes of Health, where I had worked for 32 years, mostly in technology transfer. I came to the NIH after working for two startup companies. I started in scientific review in the Allergy, Infectious Disease Institute, but went to law school at night and moved over to technology transfer and directed the office of at the National Institutes of Allergy and Infectious Diseases. Several years after that, I competed for and became the director of the Central Office of Technology Transfer, which managed inventions that were made by scientists working at the NIH, the FDA, and the CDC. Very large portfolio.
Giant portfolio.
That office also handled scientific technology transfer policy, including extramural and intramural, that is, policies affecting recipients of grants and contracts, and as well as those who are working within the NIH.
And so why did you want to go to technology transfer? What encouraged you to do that?
Well, I had some experience with a patent. I was an inventor on an invention, a patent from a small biotech company that I worked for. So I had some experience with working with a patent attorney for that patent application. It never issued, but we went through the process of filing it. And my experience in business, I enjoyed business as much as it was up and down for financial reasons, other reasons unrelated to the science and engineering. I enjoyed that and learned a lot from a startup business where everybody has done a little bit of everything. And so as I have a PhD in biochemistry and molecular biology, so I certainly enjoy science. I found that the technology transfer brings all those three primary areas together. It requires people with a scientific expertise, with legal expertise, and business expertise. Now, one person doesn't have all those perfectly, but a well-rounded office will have people who have stronger business expertise, stronger legal, and perhaps stronger science expertise. So I really enjoyed the meeting point of all those three areas.
The trifecta.
Trifecta. Right?
Yes, beautiful.
And also working with inventions at NIH, where our scientists are working on projects that are blue sky. That is, they don't know exactly, they know it will be important findings, but they don't know exactly the long-term application. You're studying a microorganism or disease and process, and you think it will contribute to the science and public health, but you don't know exactly at the beginning what it would be. And they also have more applied research, like developing vaccines for certain viruses and microorganisms. So it's a wide range, and the scientists are there to do the best science and improve public health. I really enjoyed that environment.
So the question I have is, so you have this myriad, because we've looked at all of your technologies at the NIH, and a wide spectrum of technologies, and so you have I'll call it the little R and the big R, and then you have the D, and then you have well, I would say E, but it's not R and D, little R D, unique, but that's when you actually get it to execution, or C, commercialization. And so where did you find yourself? You basically worked across that entire realm. Where did you feel that you, uh, where do you feel currently that it is most important to focus on any of those different spectrums, or is it just evenly distributed?
We need them all, and different groups, different institutions have different parts of the pie, but they have to all come together to make a whole pie.
Hmm.
Right now, with threats and actual reductions in uh, funding for science and technology, we're at a critical point that we may lose our technological edge
Mm.
in the world and not have as many products or scientific findings that improve public health because of that. So, but even with a strong, well, we had a very strong funding for science and technology. Universities, for the most part, and government labs are on that very early stage. Inventions are made uh, at a before there's sometimes proof of principle.
Hmm.
Scientists have to publish. Scientists in an academic or government lab are rewarded for publishing.
Hmm.
They can't wait several
Hmm.
years till it's the opportune time from a business development standpoint.
Hmm.
They file before they publish or give us a lecture. And that means the inventions are at a very early stage, earlier than you would typically find at a company that might wait a while to develop the technology, keep it secret until they file a patent application. So that means it's an even bigger risk for an early technology than you might find elsewhere for companies, investors to take on these new technologies and move them through development with hopefully bringing the product to the market.
Hmm.
Some say at that early stage when they're licensing these technologies, the net present value is zero
Yeah, right.
or below zero.
Hmm.
So it takes the right kind of person, investor, people who really want to see progress in public health and new technologies reach the market to do that.
So I think this is very interesting because we have advanced 60 technologies out of the NIH,
Mhm.
and one of them has received $1.3 billion.
Wow.
But we've on average seen all of the technologies we've advanced from the NIH receive an average of $10 million.
Wow.
So 72% of them. And altogether in our portfolio, the portfolio that we have advanced, there's 60% that have raised, if you take away the outliers,
Mhm.
$10 million on average
Wow.
in terms of the funding that we have been able to help them raise. Because we have the accelerator program, we have the challenge model, and then we do investor forums all the time. And we work on the their pitches. And so I'm going back to your point about the sometimes it's very early stage and people are, you said net present value is zero,
Yeah.
but some people can see it.
Yeah.
Yeah. But I think it's a matter of just kind of positioning it. At least that's my experience.
Yeah,
Yeah.
definitely.
Yeah.
Um, they may see the opportunity and they may have a portfolio as you're more invested in that process of bringing and been very successful. Thank you so much for
You're
what you've
welcome.
done over the years
Yeah.
and taking on, and
Well, I got to partner with you.
it's been a good partnership. Um, so thanks to you and your supporters, investors for doing that. It's been a great opportunity to see those technologies move forward, both for business reasons and public health reasons.
Yeah, that's what because actually altogether, we're at 460 companies we've launched now.
Mhm.
It's
Wow.
a pretty,
Miraculous.
it's not fast enough for me, but the I just need I need 10 times more, but that's how I feel about it. The so here you are, and you have done so much work to again, the entire spectrum of little r, big R, the D, and also the execution and commercialization. Let's put it that way, because I just made that acronym up. So,
Why not?
and and so what do you think the future of technology transfer is? Because I have that point of view about it as well, but I'd like to have your point of view.
Well, because that whole process takes
So long.
so long
Yes.
and needs support, very strong support financially and otherwise, moral support along the
Yes.
process,
Yes.
along that pathway. It's hard to say where we're going. We
You,
need to.
you have like 13
No,
halos above your head or
no,
something
no,
like that.
no.
Yeah. Because what you've done.
It'll be interesting to see how AI influences that
Oh
process.
yeah, no, I agree with you. I agree.
I think it can help. It's not the panacea that some people think it is, but it's a useful tool
Yeah.
and
Yes.
will able hopefully us to find the grains of diamonds in the dust of all of everything that's available and or match things. You know, sometimes the inventor has a particular idea,
Yes.
or
Yes.
and the
Yeah.
people managing it may
Yeah.
have a particular idea of how that technology may be
Yes.
useful.
Yes.
I remember one time our one of our scientists was working on dental stem cells.
Oh,
So he
interesting.
took, when his young child lost a tooth, he put the tooth in milk and waited to go to the lab and was able to find and extract some stem cells from the dental pulp.
Wow.
And his idea was that it could be used to grow teeth. Well, lately it's been in the news. This was a long time ago, but lately it's been in the news that about growing teeth, but far off. But we talked to, when our scientists came together, an internal team to look at the technologies, someone said, and we talked to some companies as well in dental technologies, and they said, really, what we need right now
Mhm.
is bone. And
Mm.
these stem cells can help grow bone.
Oh, yeah.
And that's what we need right now. That's the
Mm.
biggest weakness in,
Interesting.
say, teeth transplants and things like that,
Mm.
implants. There's not enough bone tissue, and you had to work in other ways to build up the bone. So you never know where somebody else with a different perspective, a different business perspective,
Mhm.
or marrying a couple technologies together
Mhm.
will bring a new successful product.
No, Mark, I totally agree with you. When we did our Freedom from Cancer Startup Challenge, because we're in the 12th challenge now, what we did was we went through 120,000 intentions. I mean, it was quite something.
Mhm.
And what we did was we combined different technologies. They're usually across about 12 different, well, let me say 8 to 12 different institutions.
Mhm.
And really, they just all needed each other.
Mhm.
And I think that your point is extremely valid that you really need to think about looking across the spectrum. And that gets me back to, you know, what I think about when I think about the future of technology transfer is that, and I know this has been going on for a while, the point of view of having like a database of all of them, and we have like a database of 170,000 inventions, but that allows us to marry, if you will, to your point, different technologies together. But I wonder if there's a way, from your perspective, to make it more transparent. Not like if we have this database, but the thing is that we, you
Yeah,
know,
I think there are opportunities for people, people who manage inventions, technology transfer people
mhm.
in universities and government labs to make more information readily available so that various tools from can be used, applied to find those kinds of technologies and fill gaps that otherwise are needed to make a technology work.
But so, you know, I think about this, you know, there's all these collaboration agreements across institutions. So, and obviously it's when we do our research, we look at PubMed,
Mhm.
we of course look at IP,
Mhm.
we look at just social media, you know, quite a number of different avenues
Current
to,
treatments and what's
yes,
available, what is needs an improvement, or
yes,
what's not available at all.
yes. And the unmet need,
Yeah.
and where's the largest impact and commercial viability. But the thing is that I don't think that, well, you can uh, you can respond to this. I mean, I don't. I mean, we're doing it because we really, the Center for Advanced Innovation, what we care about is advancing innovation to make an impact on humans, and basically the same terminology that you use on human health. And so, but the main thing I see as an opportunity is that some kind of, really that, I mean, we have only 170,000 in our database, but there's more than that. So the question is, when I think about the future of technology transfer, I think about really a harmonization of technologies and somewhere people can really try to combine the different kinds of technologies, because we frankly do it with algorithms and my right hand guide is Cody and my left hand guy is Cody. And
It's not easy.
no, it's not.
We need to improve it.
Yeah. And that's where the AI point comes in, I think. I mean, it's not gonna be perfect, but
Can help, could
Yeah.
send you in the right direction.
Yes. So when you were talking about, so I really believe in your thought process about multidisciplinary, teams that have to come together to truly advance the technology. You said scientific, legal, and a business expertise. And so, we're called, the Center for Advancing Innovation has been called the Tinder for startups. I never thought in a million years.
Yes, it'd be called.
Oh my gosh. Because I would feel like, because my background is like investment banking and strategy consulting. The now I'm the Tinder for startups. But
Is that in advance?
I think that, when you put together teams, when you do projects, basically you're putting together a well-rounded
It's a
team.
useful way to explain it to people, especially if they're not familiar with the process.
Yes. So, and Nature did that. Nature called me
Oh,
that. The Nature magazine, you know that one. Well, it, of course. I actually has my mom framed it actually somewhere. Probably see it on my wall somewhere. This is another database, by the way. So we're not gonna look at that right now. You can take that. So the main question I have for you is, how are you able to really combine the skill sets? Like, what was your avenue to do that?
well, hiring the right people. I mean, you can't demand that everybody have a PhD and a MBA
Yeah, I
and
agree.
a law degree. That's silly.
Yeah.
And so
That's a
you
good
need to
point.
look with people who have the energy and the drive to do this, but also look to have an office of people who have the various expertise. Some people have worked in it, like Steve Ferguson, for example, at
Yes.
NIH. He had worked in industry before he came to NIH many years ago in tech transfer. So, and there are people who have, and he has an MBA. There are people who have just like, well, even in the science area and technology, you need people with a multidisciplinary outlook. Sometimes you may go to somebody with greater expertise in one area, but having people who can look at a technology and understand it, maybe not in the detail all the time, but understand its implication with reading an article or some support from scientists and engineers who are looking at it. You need that kind of perspective. You can't be narrowly focused. Some scientists succeed dramatically by focusing narrowly on one topic and exploring it to death. You can't do that in tech transfer. You need to have a broader approach in looking at various technologies and thinking about talking to your colleagues, talking to people on the outside sometimes to understand the possibility. What are the legal strengths and weaknesses? What are the regulatory, science, technology, health, all of those things? You need some way to have that kind of input in managing the technology.
And so how do you engage with the people to come together? Because that's a kind of some, because you mentioned, you can drill a hole to China. I'm making this up. Well, I'm not, I shouldn't say that. But you could drill a hole and then be very narrowly focused. But how do you get people with broad perspectives? And is it just the way you recruit people?
You need the right team, and you need to help train people who are new to have that kind of broader perspective.
Mm.
Not everybody can do it, but you can find the right people who can and do it well. And you have to have a good working relationship. You have to have good communication skills. You have to have good working relationship skills to talk to scientists. And, scientists, like anybody else, can be super collaborative or not so collaborative. You need to relate to people so they trust you. You don't cheat people, you're honest with them. And work with them so you help them as well. Most scientists would like to see their technology help somebody. Maybe they don't want to be involved in doing that, but they want to help at those early stages so other people can take it on and do it. Sometimes just want to be in the middle of all that.
So can you give me an example of just being honest with somebody that you had to have a conversation with, that, well, I shouldn't say have the opportunity to have a conversation with that.
Well, like when a scientist, I know my experience when I was at Allergy and Infectious Diseases, if a scientist brought technology forward and an internal committee of tech transfer and scientists looked at it and said, it's just not, this isn't like,
it's not going to go anywhere.
It's not going anywhere where it is.
Yeah.
So rather than just delivering the news that this isn't going anywhere, it's a flop, we look for what does it need. So you're giving positive feedback that this is what it needs to be successful.
Very good.
If you're interested in doing that, I can work with you. If you're not, maybe it doesn't advance in that way.
So, Mark, if I may say so, what you're doing is you're taking talent and connecting it with opportunity to proceed further.
Yeah. Most people will take that kind of input, and occasionally they don't do it so well, but most of the time I've had great experiences working with scientists, and likewise working with companies and investors and startup people. You need to be fair, you need to be honest. You stake out a position, you need to protect your own institution in your own position, but you need to be fair and honest with the other person and understand where they're coming from and what their need is, and try to find a way where you can both have your needs met. It requires some compromise, but you need to have at least the core of what your needs are met in that collaboration. And if a company is not fair and honest in dealing with you, maybe you don't want to do business with them. But that's rare. It's really rare. It's rare, but you want to look out for it.
So I already asked you about, what you think the future of technology transfer is. But if you were to have like the magic pixie dust that came down, what would it be that would you see in the future?
Well, we all heard of the Valley of Death, at that stage you have an invention, you have some early data, but to get it to the point where investors are interested in it, you have this gap of funding. It's hard to find funding to help bring it to that point from the very earliest stages to the early stage, less early stage, when investors were interested in it.
Yeah, yes.
And the programs that succeed the most find ways to fill that gap. So some universities have investment funds where they will use smaller tranches of money to help move the technology through some kind of test in animals or some other outside contractor help to get more data. And that's very important. Sometimes states and localities have programs, incubators, and other ways for scientists, engineers to move through that early stage so they get more data, more support, and you either want to kiss or kill it. If it's not going to work, you want to know as early.
Kiss or kill it. I love it.
You want to know early on before you
right.
invest more time and
Yes,
effort that
yes.
it's not going to work that way.
Mhm.
Or maybe something better comes on along the line, and you just feel like there's no way I could compete with that. So you want to find out early, you want to do that testing. And when you do have positive data, it makes it more valuable. Not only will more investors be interested, they're going to give you more money to license it than if you had just this very early, the earliest of data.
Mhm. Well, I have another question about, I think about this a lot. So, you know how people don't like bad data. They don't want to share bad data. Like, okay, this thing failed, right? So I wonder, and I'd love your perspective on this. And I'm going back to your point, by the way, but okay, so you have bad data, but no one publishes it because it's bad.
Mhm.
And then you have good data and people publish that. And then they get funding.
Yeah.
But how many times do people have bad data and then another person does the same thing and then they have bad data? And then another person does the same thing and then they have bad data, but the bad data is never shared, right?
Mhm.
So I don't know. I would like to have your perspective on how can we improve that situation? Because we're spending money over and over and over again because people have the same hypotheses. And then, of course, there's one over here that is successful.
Well, NIH has some initiatives to help foster the people releasing in some manner unsuccessful experiments.
Okay.
You want to be careful. There's more than one reason something is unsuccessful. If the experiment is planned properly and
Right.
is well supported in how it's done,
Mm-hmm.
a negative result is very useful for people to know.
Oh, agree.
If it's a negative result because you didn't do it right or properly, you don't want to release that data. That's
No.
just going to confuse people in the wrong places. But a negative result can lead to, okay, that doesn't work. What might work? Think of Edison with the light bulb. How many times did he try that didn't work? So it wasn't failure each time. It was an opportunity to move on to something else until the 100th time or what it was, he found something that worked for the light bulb.
Mark, I think about this. When I was applied for Goldman Sachs at 19, they told me 145 times no. No, because I didn't have an MBA yet.
Mhm.
And the 146th time I read a proposal for them,
Mhm.
and they said yes. So you just have to keep going and thinking.
You learn from your failure, like
Yeah.
and business people do.
Yeah. Mm.
You gain experience from it.
Yes. Okay, so what are you doing next?
Well,
What
I'm doing some consulting.
Yes.
Some of it, a little bit, I may do more in the future, but some of it is really looking at policy issues around government funding and inventions and claims that inventions were government funded. So we want to know more about legislators, one, other policy people, people on the right and the left want to know what more clear information about what is government funded
Okay, that's
and
very
what is
important.
not.
Mhm.
And so there's the obvious where someone clearly states does everything they should do to make that statement clear. And there are other times where they might try but not do it well. So I'm looking also at technologies that were reported to the NIH and inventions that were reported to the NIH and those that were only reported in the patent document. How are they reported? They're reported in many different ways in terms of the structure of the statement of government support. And we'll learn more about, there have been claims that a generous fraction of publications and research results were government funded when they may or may not be. So we don't want to draw false conclusions. We want more accuracy in how we determine. There's always an area that's really hard to find because there isn't any information about the funding, source of funding. But there are other areas where we can clarify and do a better job in understanding for doing policy research and understanding better how do we find what's available on inventions that were or were not supported with government funding.
But this is a very important point because I've done a lot of analysis. So we call it the innovation arms race, and we are looking at what's government funded and what is not government funded. And on our R&D, GERD, we look at per capita. We look at a lot of different things, but we have a lot of very interesting findings. In the United States, we're like pretty much flat on a lot of the metrics and going down on some of the metrics, and others are going like this. So but to your point on understanding what's government funded, it's not too clear. I mean, all we can do is get the data from the databases, and they're usually about 6 years old. So how do you figure it out?
Well, I'm looking at the patent documents themselves.
Okay.
That are either in international database called PLANS or from the patent office, searching for words that and grant numbers in many different formats because they're, and as well as some typos. It's really hard to find a typo. But even a simple thing like looking for an R01 instead of an R, I'm looking for an R01 instead of an R01. We say R01, but it's not an O, it's a zero. So, if you're doing a Boolean search and it's not exact, you don't find it. So you need more, either other ways to look or more sophisticated algorithms that will look for that difference. That's one way, but there's a fraction of inventions that are reported in the patent data on the patent, but they're not in Reporter, which is the database
Yes,
that's
I like
publicly
Reporter.
available on inventions made from the NIH.
And the Reporter?
Because the final patent, either they've never been reported to the NIH or the final patent number was never reported to the NIH.
Oh, geez Louise.
And so what I found is that maybe for the typical R01 awards, inventions are about 85% reported to the NIH that are also in the patent document. So there's about 15% that you can find in patent documents that you don't find in the public database report. With small businesses, the level is lower. So if you look at all of the
level is lower.
That is with small businesses, which is not unexpected. Small business has many other things to do. They're not, and there are lots of changes, changes every week at a small business.
Absolutely. Yes.
And they don't have the infrastructure of reporting like a university does.
Yes, right.
They have people dedicated to that. So it's a higher lift for businesses to do that.
Yes.
They're reporting it on the patents, which is important. You can look there, but something is missing with maybe 30% or more of inventions that are made at small businesses with government NIH support. The other thing is NIH has this great resource called Reporter with all of the information of grants that are awarded and inventions.
Yes.
But other agencies don't have that.
Yeah.
If we had one resource where you could look for those.
That's exactly where I was going.
And be able to, give that data to others who in the private sector, manipulate it or offer it as a service, whether bells and whistles, it would be great.
You just painted the future because I have a white paper on that. Mark, we have done so much work on trying to put all these patents together, and the IP together and so on and so forth to make sure that we.
Well, and the other complexity is you have the claims to a patent. You know what they're claiming, but you don't know, you're not, a patent attorney would look carefully at the whole application, the history of the application to see whether those are well supported.
Mm-hmm.
So you might have claims that are not, you might have some claims that are very well supported, that are narrower, and you may have broad claims that aren't as well supported, that are more at risk for being challenged. So if you really want to do, if you're in a business starting it, you want all of that information. It's so hard to do that. You know, you can't do it, something with a large inventory like a portfolio like you mentioned. You can't look at everyone in that
No, you
way.
can't.
You'd spend
Yeah.
$billions
Yeah.
with patent attorneys
Oh my gosh.
looking at all the history.
Oh. Huh. Yeah, we've been doing, I think I dream of patents. I dream of patents and
I
financial
dream of patent
models.
number, any numbers.
Well, okay, so if you could maybe wrap up with your what guidance would you give people who are going into collaborations or technology transfer? What would you say the future is? I mean, you already talked about the future before, but what would you say that your voice of wisdom?
Develop good partnerships,
Mm,
honesty in trading and communication, and do your homework. Um, look carefully at what you have, the strengths and weaknesses and possibilities. Talk to experts, like the I-Core program that government agencies have. A investor talks to many different people about who could possibly use the final technology, and ask them, what about this might work for you? You have another way of looking at this? How can we develop it in a way that that best suits your
mhm,
needs? Like with the teeth, with the stem cells, dental stem cells,
I love
Yeah.
that. That was a great example.
You wanted to grow bone. We
Yeah.
didn't need it at that time to
Mm,
grow teeth, and that
mhm,
would be a harder lift.
mhm.
So, you need to have that kind of input from a wide array
Yeah.
of people.
For our accelerator program, we have them pitch to about 600 investors. Um, so they basically get some feedback on that as
Yeah, they'll
well.
tell you what it needs.
Yeah, oh yeah, they will.
Maybe it's a $50,000 experiment that would give them the data they want.
And the things that um I'm going to say this because I feel very strongly about it, but we don't charge anybody for going through our programs,
It's great.
And,
Thank
I
you.
feel that about me. I don't. I feel like it's. I mean, you have startups or just advancing technology,
Mhm.
and they don't have money. I mean, they need money,
Right.
So we have to find out an avenue to get the money. And then so uh, I'm very excited about, and I do think the I-Corps program is also very strong,
Mhm.
and they get to, they're interviewing people, they're getting them accept, and I have to tell you, I applaud you for all the work you have done. Why don't you tell me a little bit about your award that you just got?
Bayh-Dole.
Yeah, this is
and
very important.
So every year, the Bayh-Dole Coalition gives awards to about 5 or 6 people who they recognize for their contributions and advancements in technology transfer. Many of them are inventors who started companies. Um, uh, there was a professor from Wisconsin who had invented some years ago, looking at developing diagnostics using SNPs, small pieces of DNA
Mm,
that change depending on what type of disease you might have, or if
mhm,
you have cancer, they look different.
mhm.
And so he invented this. The technology is now used in Cologuard. So it, it's those kind of contributions. It may be people who manage tech transfer offices, people from the beginning, like Kathy Koo,
Yeah.
who has made great contributions. But this year they decided to give an award for my work in policy. So we all think a lot about what we've talked about, the process of technology transfer. But behind that, government agencies have a lot of responsibility to manage the Bayh-Dole Act in a way that supports the goals. That is, getting technology out for investors, for one working with inventors to file the patents applications, and seeking investors and other companies to take on these technologies to bring them to the public. Well, the government retains certain rights in those inventions when they're government funded. Two, the government has a right to use those technologies for its government purposes, not to give them at arm's length to somebody else.
Right.
But if you're working in the government to do something with government funds, then you have a license, free license to use the technology. So someone could sue you, but it would be dismissed for using that technology if it was government funded. Secondly, the government has march-in rights.
Yes.
So the government can essentially, through a long, tedious process, could take away a patent from a company that's marketing it if they're not meeting certain
Milestones, right?
milestones. So the main way that the march-in statute was written and developed was for non-development. So some companies taking on the technology and sitting on it for anti-competitive reasons, or they I knew years ago a company just they were so risky to do the clinical trials that they really were stalled. They weren't really doing it. And the university had licensed the patent years ago before we had strong milestones and due diligence and licenses, couldn't get the company to move off the dime. So we talked with them about march-in, and many times, you can find a way to solve the problem. March-in is the backstop.
Yes.
It's the last thing you want to do.
Yes.
Or even consider
Yes.
activating. And the idea that I should say about 20 years ago, 25 years ago, some academics published an article saying, well, march-in could be used when prices are unreasonable, drug prices. We all understand there's a big problem with access to drugs for people who are uninsured or who have no insurance. And we need to address that as a country.
Yes.
But the idea that we could take a patent away from a company that's making the product because we determine the price is too high.
Yes.
Even though it's on the market like every other drug. Well, they raised that issue and said the government should do that. Well, some other groups, nonprofit groups, came to the NIH multiple times saying these particular drugs are priced too high. They're higher than other comparable things, or whatever way they're looking at it. And the government should start the march-in process and take away those patents from those companies and give them to a third party company to develop them on their own. Well, that's not what the Bayh-Dole Act. And so when you're working in policy in the government, you need to be sure that you're not just looking at something in a way that it's what's the expression?
Pennywise and pound
pounds foolish, right?
Pennywise and pound foolish.
It's not the way, it's not the way that you would solve the problems. And also, if you're going to do that, when you do that, if we did it, we haven't done anything on this, but if we did it,
Thank the good Lord.
companies would want, investors and companies would want new technologies. Who wants to take on a technology when the government says, well, in 10, 15 years, when you develop it, we'll decide if your price is reasonable. By what standard? Under what administration? What investor would do that?
And also with the new the news about reducing the amount of price for all our drugs to make them the same price as the other countries.
No,
Yeah.
we're looking at, that's a complicated issue
Yeah, it's
that
very
we could spend
complicated.
days talking
Yes.
about. But marching is not the way to address it.
No, I agree
And
with you.
so by holding, I was the lead policy person when I was in the central office of tech transfer.
Mm.
That was reorganized and I moved to the director's office and still had that responsibility, lead person for policy and Bayh-Dole.
He's a rock star, by the way. Did you see?
Did my job.
It's tattooed on his chest. Rock star.
And so it was important. Fortunately, the thank goodness for NIH leadership over the many years, Democrat and Republican administrations, who believed in what we were telling them, and the potential, the big risks with using Marchand, and the lack of success in really doing anything. I mean, there are many problems with that concept, but fortunately, the leadership
Understood.
believed it
Mm.
and fought for it as well. And it was only in the last administration that became very political, with some members of Congress and some members in the administration, people in the administration who were pushing hard, very hard for Marchand
Really?
on a few drugs.
Very interesting.
And the NIH held back and was able to decide not to march in for this particular drug a couple of years ago.
Very good. I remember when you and I and Bonnie talked about Marchands. I think
And thanks to people who helped, Bonnie, one of them, and others over the years who really did a great job investigating these potential, these claims and working with me on it. I
Yes,
appreciate their help.
You've done God's work, really. And I want to tell everyone that Mark Rohrbaugh is fabulous, and I'm very grateful for your time today. And
Thank you.
And
It's
your
been a
wisdom.
pleasure.
And so you'll see some more of him. We'll be sharing some videos for you, and great wisdom, and thank you.
Thank you.